Hi, welcome to Joint Camp. Thanks for taking the time to watch this video. We're going to be going through a lot of information today. My name is Carrie. I'm a nurse that works in surgery. You can see me in the pre-op area, the operating room, or the recovery room after your surgery, or any of my coworkers that work down in surgery. We're going to be going through a lot of information today. You should have gotten a bag with a packet of information and a couple of items in the bag from your nurse when you made the appointment with your surgeon that's going to be doing the surgery. If you did not get that packet, please let us know and we will find a way to get it to you. You might want to grab a pen and paper to just write down some notes during this presentation, just to remind yourself of some things that you might forget along the way. Everything we say in this presentation, though, is going to be in the booklet that's in your folder, so you can always reread everything through that. So today, you're going to be hearing from me, a surgical nurse. You're also going to be hearing from occupational therapy, physical therapy, and also social workers today. There's going to be a lot of people working with you while you're here in the hospital during your surgery. You're going to have a large team. Who is going to be on your team? You're the most important person, of course. And you should also have a coach, somebody to be with you kind of during these the beginning parts of knowing what to do for your surgery, during your surgery, and then taking care of you for a few days after your surgery. You'll also be working with your surgeon, of course. The surgeon has physician's assistants that they work with that will see you afterwards on the hospital unit to check in and see how you're doing. Anesthesia will be working with you, all of the nursing staff, occupational therapy, physical therapy. The pharmacist will be looking over all of your medications, and also social services stops by to see how you're doing before you go home. So in this slide, we're talking about the coach's role. So it's important to have somebody with you, especially those first few days at home. It doesn't have to be a spouse. It can be anybody that's willing to spend, the first few days with you. They are going to help you keep track of, when you took your medications, getting ice for you, keeping your water, keeping a glass of water by you, your water pitcher filled, helping you get snacks when you need it. You're going to be a lot less mobile right away after surgery, so it's going to be really important to have somebody with you those first few days. As far as the coach, be available. Make sure that, the person that you're taking care of has ice when needed, and that they're eating when they should, and staying on top of their pain medications, things like that. So a lot throughout this presentation, also in the book, and when you're here in the hospital, we're going to be repeating things over and over again. It's just because we have a lot to go through, so there's a lot of different ways we, go over these things with you. And then also you'll hear us say over and over again that it is important to start the exercises that are in the back of your booklet now, so that you can build up your strength before surgery, and that will help with your recovery after surgery. So getting ready for your surgery, you will have a pre-op physical within 30 days of your surgery. You will also have some lab work that will need to be done. A lot of times people go in right before that appointment, right here at the hospital, and get their labs drawn. That way it's ready and back before their primary physician looks at that, so they can make sure all the labs look good. Depending on what your primary provider thinks, they also might get an ECG, a reading of your heart. And then again, a reminder to start those exercises before surgery. So we do have a checklist in the booklet to help you to know what to bring to the hospital. Don't overpack. Just remember, whatever you bring to the hospital, you're going to have to unpack when you get home, and you're not going to be very mobile. So you can keep it pretty light. Leave all of your jewelry off, watches, rings, earrings, necklaces, and just leave them at home so they don't get lost while they're here. We won't let you wear, jewelry in the operating room, so it's better just to leave it at home so it doesn't get lost. Think about your home ahead of time. Do you have a lot of stairs to get into your house? Are your walkways, are they wide enough to accommodate a walker? Think about your bathroom. Do you have a step-in shower, or is it a tub shower combo? Is your toilet low to the ground? Especially for hip replacements, you might want to consider getting a toilet riser. It's going to be hard with some of the restrictions that we have on some of the hips to be, getting up and down on a lower toilet. So we'll kind of talk about that later. And also think about your bedroom. Is it upstairs? If it is, it might be worth setting up a temporary bedroom on the main floor so you don't have to go up and down so many stairs, especially for that first week. Tobacco and alcohol both have an effect on recovering from surgery. They both can affect wound healing. You tend to have more pain, increased risk for blood clots, increased blood pressure and heart rate. So we always suggest quitting tobacco and alcohol use now. If you need any help with that, you can give us a call and we can, find a way to help you with quitting. You can always call us for anything you need with that. Thinking about your diet until surgery, eat a lot of foods rich in calcium and iron. Calcium to help build up those bones and help them recover after surgery, and then there will be some blood loss with surgery, so thinking of eating red meats, things high in iron, will help with that. Also, just know that your appetite might be poor for a few weeks after surgery. A lot of people don't feel like eating quite as much, so kind of prepare ahead of time smaller meals to have available or packed away in the freezer. Protein shakes, bars, smaller foods like nuts, dried fruit that are high in protein, and you can just eat little bits at a time. Also, be thinking about having protein in your house before and after physical therapy can help with your muscles healing and returning to normal. Another thing to think about is having a plan for ice. It's going to be really important to ice that joint that's replaced the first week. If you want to just use bags of ice, just make sure you have a lot of ice in your freezer. We have had one patient tell us that he went through 300 pounds of ice. So make sure you have enough ice ready to go. Some people use those gel packs. Those are nice too. If you are using gel packs or ice, make sure it's covered with a towel and not directly on your skin because you could get frostbite with that. And then also icing the joint for about a half hour on, half hour off. Kind of as much as you can while you're awake, especially for that first week, will really help with swelling and pain. Another thing we like to mention is in the picture there is a Polar Care ice machine. That's a cooler there that you can fill with ice and water. And then the attachment you see shown there is for a knee. They also make hip attachments. You connect the attachment to the cooler and then plug it into the wall, and then ice water circulates constantly through that wrap. And that you can actually leave on 24 hours a day. That's one thing that's kind of nice about having that too, is you don't have to think, oh, has it been a half hour? Has it been a half hour on, half hour off, and kind of keeping track of that. And that will especially be important, like I said, that first week. If you are interested in the Polar Care ice machine, you can borrow one from somebody that's had surgery before, or you can purchase one through the Detroit Lakes Equip store. That's our closest Equip store. The store is located across from Central Market in the same strip mall as the Dairy Queen. Insurance will not cover it, but they do take HSA accounts and Flex Money accounts for that. The cooler is around $160, and the wrap, I think the last time I checked, was around $60. So it's about $220, I believe, from that equipment store. I do think I've seen them online too that you can purchase. If that is something that you want to go with, the surgery department does need to put in an order for that in order for you to purchase that from the Equip store. So give us a call if you want us to put an order in, and then we will get that ordered for you. And then you will go and pick that up at the Detroit Lakes Equipment store. Another little tip and trick we like to say with that cooler is some people buy 8 kind of smaller water bottles. 4 of them fit inside the cooler. You can put all 8 in the freezer, and then when you're ready to use it, put 4 of the water bottles in the cooler, fill it up with water, and then when the water bottles get warm, you can just switch them out for the 4 that are in the freezer. So you just keep switching out the same 8 water bottles. So that's another little trick for that. So a day or two before surgery, you'll get a call from us. We will go through your arrival time. We won't know the time for your arrival until a couple days before. That's because our schedule is constantly changing. So you will hear from us a day or two before your surgery. We'll go over all the instructions again with you then, and your medication instructions also. Have your bag packed, kind of eat a light supper the night before. We say don't go to Pizza Ranch and have the big buffet, just kind of eat something light. In the bag that you got from the pre-op nurse in the clinic, you should have gotten some Hibiclin soap. Some of the soap comes in a little bottle. If it came in a bottle, pour half of that soap on a washcloth and wash neck to toes. I would stay away from your face and your groin area. It tends to be kind of harsh on that. But wash head to toe and then over the joint area that's being replaced for about 3 minutes. The other half of the soap you're going to use in the morning. So use half the night before and then half the morning of. Nothing to eat after midnight, and then you can have water until 2 hours before your arrival time. 2 hours before your arrival time, that's when we're going to have you drink that Ensure drink that you got in your kit. The Ensure drink is mostly just to help with your appetite afterwards. If you don't like it or you forget to drink it, it's not that big of a deal. We would rather have nothing in your stomach at all than having you drink the Ensure drink a little too late. And again, we'll go over those instructions with you when we call. Some people do say that the Ensure drink tastes better in the fridge, so you might want to refrigerate it. The day of surgery, get up, brush your teeth, spit out the water so you don't swallow any water. Take a shower again with that Hibiclin soap. There should also be instructions in that folder on how to shower with that soap, so if you forget from this presentation, you can look in your folder. Wear clean, loose-fitting clothes that you can wear home again. Your joint is going to be swollen. If you're having a knee replacement, you're going to have an ACE wrap on. So wear something loose-fitting, especially for pants, maybe some sweatpants or something, just so you can get it up over those incisions. Leave any makeup, perfume off. Take any nail polish off your feet, especially. And we do say no shaving about 5 days before your procedure, and also leave any lotions off the day of your surgery. Take only the medication you were instructed to take the morning of. And then if you do wear contacts, remove your contacts and only bring glasses. We do not have a glasses case here, so I always recommend bringing a glasses case to put your glasses in. Just because it will protect them while you're in the operating room. Your glasses won't get broken being transferred from the pre-op area to the room on the hospital unit. And then usually the front desk when you check in will ask for insurance information, so bring that along when you get here too. So the day of your surgery, if somebody's driving you, they can park in the emergency room parking lot. Come in through the emergency room doors and you can get registered at the emergency room desk. Bring your overnight bag in with you. I also say if you have a walker, bring that in with you. If you don't have a walker, again, we can order one for you. Just let us know. Call the number that is listed for surgery in your folder, and we'll get a walker ordered for you. But that is all you'll need to bring for equipment is your walker. Everything else we have here, so you can leave any other equipment at home. And then once you're here, they'll bring you back to our surgery waiting room. We'll bring you back to our pre-op area where we'll have you change into a surgical gown. And we used to put in catheters for total joints, but because of infection risk, we don't do that anymore. So we will have you put on a disposable brief. We'll wash that joint one more time with a skin prep, and then an IV will be placed. Anesthesia will come in and talk to you about anesthesia, and your surgeon for that day will come in and talk to you before your surgery also. So for your safety, we're going to be repeating this information over and over again, and then also once you're here in the hospital, we'll be asking you your name, your date of birth, and what you're having done, which side it is. You're going to hear us asking that over and over again, and so please be patient with us. It's just all of our safety checks along the way. Hip surgery usually takes about an hour and a half, knee surgery about 2.5 hours. Most people for anesthesia go for a spinal anesthesia. A spinal is a one-time injection into your spinal fluid in your back. When you come into the operating room, you're going to feel a little bit like a car at a NASCAR pit. A lot of people will be giving you attention. We'll be putting a blood pressure cuff on, an oxygen monitor, heart monitors, things like that, and we'll have you sitting on the side of the bed for that spinal. So when you're sitting on the side of the bed, anesthesia will give you some little relaxing medication in your IV. Like I said, it's a one-time shot in your back. It numbs you from the waist down for about 3 to 4 hours. So you won't be able to feel anything below your waist. The thing that's nice about that is you will still be sleeping during the procedure, but they don't have to give you quite as much anesthesia because you won't be having any pain since you're numb from the waist down. When you wake up in the operating room at the end of the surgery, people tend to be wide awake, comfortable because they're still numb, and when they're in the recovery room, they're talking and maybe able to have a couple sips of water right away. So after you're done in the operating room, you'll be in our recovery room for at least a half an hour. We'll be monitoring your vital signs closely. We'll put ice on your knee or hip that was replaced. X-ray will be in to take a picture of your new joint. And we're going to be reminding you to take deep breaths. And then also, like I said, most people are kind of wide awake at that point because they didn't have to give you too much sedation during the procedure. People are usually able to start wiggling their toes and moving their legs in recovery, but their legs and toes are still pretty numb. Once in a while, somebody's spinal is starting to wear off and they're starting to feel some pain. If that's the case, we start dealing with that in the recovery room. And then once you meet all of our criteria, your vitals are stable, if you have any pain, it's under control, you're not nauseated, then we bring you to your hospital room. Once you're in your hospital room, that's when you can start eating and drinking again. We'll continue to put ice on your joint that's replaced, and your spinal will continue to wear off. Once your spinal starts wearing off, that's when you will start having pain. We do as much as we can to control your pain with pain medications, ice, elevation, things like that, but just know that this is it's a large surgery, so just know that you will be having pain with this surgery. We do as much as we can to keep it under control. Once your spinal has worn off, that's when you are able to get up and start walking, but make sure that you are with someone the first time you get up, since you also will have some cuffs on your lower legs that are attached to a machine to help with circulation during the surgery and after while you're in bed, so you'll still be attached to something. So just make sure that the first time you get up, it is with a staff member. So therapy will be in to see you a little while after your spinal wears off. And then they're going to go over in a minute all of the equipment that you may need or may not need. And so they'll go over that in a little bit. You can buy the supplies or borrow them. And the only thing we require you to have for sure is that walker. For diet, like I said, your appetite won't be that great after surgery, so small, frequent meals are great. Also, keep in mind that with the pain medication, it is a narcotic, and also you're not going to be as mobile before, so people tend to have more constipation. So foods that are high in fiber, drinking lots of fluids, lots of fruits and vegetables. Also eating foods that are high in proteins and iron to help build up those iron stores after your surgery and also help with muscle recovery. All of that will help with your recovery and build up your strength afterwards. Some people will want to go home the same day. If that's the case, please let the surgical team know when they give you a call beforehand so that we can let physical therapy know the plan. If you are going to go home the same day, then they will try to get everything done in one day. If you're planning on staying overnight, that's just fine. We will spend 2 days then going over all of the physical therapy that you need to go home. So if you're staying overnight, you'll be getting up bright and early the next day. They'll draw your labs in the morning. Physical therapy and occupational therapy will be in to go over everything, and then social services will stop by. There's a lot of things we do to prevent blood clots. That first bullet point there says keep your SCDs on. So that's the cuff I mentioned on your lower leg. The SCD stands for sequential compression device. It's basically like a blood pressure cuff that puffs up your leg in sequence just to keep that circulation going. So we do that to prevent blood clots. You'll also be on a baby aspirin to take twice a day for 6 weeks after, just to help prevent clots. And then if you are currently on a blood thinner, we'll give you directions for when you go home as to what to do with that. For going home, either your surgeon or a physician's assistant will stop by and go over discharge instructions, and also the nurse will go through all of the discharge instructions before you leave. Make sure your coach is going to be picking you up in an appropriate vehicle, so hopefully not the tallest truck that you have to climb up into or the lowest sports car that it might be hard to get in and out of. So just make sure that it's kind of a mid-size car that you can it'll be a little bit easier to get in and out of, kind of more of a mid-size. And once you're at home, watch for signs and symptoms of infection. It is normal to have some drainage on that dressing. It is normal to have some swelling, some bruising. But if after a week or so you start noticing more drainage, more swelling, more redness, more pain, and maybe even a fever, that could all be signs of an infection, and then call the clinic and let us know. Also, if you have anything kind of extreme nausea, vomiting, fever, chills, anything like that, always please let us know. For Dr. Nelson's total joint replacements, those patients will be sent home with a dressing. So you'll have a dressing on your incision site, and then he will want you to change that dressing with the one we sent you home with in 1 week. Just make sure you wash your hands really well when you're changing that dressing. Kind of take the old one off, throw it away, wash your hands, open the new dressing, and then just kind of put it over the incision without touching the incision or the inside of the dressing. It's really important to keep that incision free from germs, so hand hygiene is very important. Dr. Muckenhern's patients will keep your dressing on for 2 weeks until you see, a lot of times you see his physician's assistant at your 2-week appointment, and then they will take the dressing off at that time. Again, don't be concerned if there is some drainage and bruising, that's normal. Just if things start getting a lot worse, that's when we want you to let us know. All of your follow-up appointments will be made before you leave. If you're planning on doing physical therapy somewhere else other than our hospital here after your surgery, you might want to call the physical therapy office that you're going to be doing that at to let them know what date your joint replacement is at so they can get you on the schedule. Otherwise, we will set up your physical therapy here if you're going to be doing that here. And then your surgeon will let you know when you can start driving again. You will be going home with pain medication that is a narcotic, so just make sure you don't drive while taking those narcotics. So going home, is your house and coach ready for you to go home? Have you met physical therapy and occupational therapy's requirements? Do you have all your supplies? Do you have your ice plan ready for home? And make sure you get your prescriptions before you get home. For pain management, they will prescribe you some kind of narcotic. Some of them do have Tylenol mixed in, so make sure you pay attention to that and don't take Tylenol at the same time as the ones that do also include Tylenol. NSAIDs are the class of drug that include like ibuprofen, Motrin, Aleve, Advil. Do not take those for a while after your surgery. They do tend to cause bleeding, so ask your surgeon when you can start taking those again. Also, the ice is going to help tremendously with pain, and then doing those exercises beforehand and after with physical therapy will help managing your pain also. For bathing, you can shower the day after surgery. We just really don't want you to get that dressing or your incision wet. So we suggest something really easy to use is Press and Seal. So Press and Seal works really nicely to just put over your hip incision, or you can wrap it around your knee if you have a knee replacement, and then kind of tape the edges of that plastic wrap, and then you can take a shower. We just don't want you soaking in any body of water No tubs, hot tubs, lakes, pools, anything like that until your incision has completely healed all the way across and there's no divot in the incision. We just don't want any water seeping in there and then the germs to kind of get in there and kind of cook, if you will. So make sure once your dressing has been removed, even though you can shower and let the water run over the top of that incision, just don't soak it in any water and try not to scrub it with a washcloth. You just want to keep germs away from it. All right, and now we'll transition to therapy.
Hi, I'm Dave Dahl. I'm a physical therapist, and I'm going to talk to you a little bit about exercises and things you can do to prepare for your surgery. When you have your total knee done, typically physical therapy will see you 2 to 3 times per week, at least for the first month or so until you recover your range of motion. Hip replacements are typically seen a couple times a week. Again, if you let us know what your plan is when you come in, if you're going to have therapy done somewhere else, just so you have that worked out. Otherwise, if you're going to have therapy here with us, we will try to get that first appointment scheduled for you. If you have your hip replaced, there are 2 different ways that hips are replaced by our surgeons. There's a posterior approach and there's an anterior approach. The posterior approach has specific movements that you need to avoid for a while because there's a weak area that's created with the incision that potentially could allow your hip to dislocate if you did certain movements. So although the surgeon stitches that all up again, that weakness will persist between 6 and 8 weeks. And so for that time frame, you should not bend forward more than 90 degrees. So that includes both sitting and bending forward to get to your feet, to get your socks or shoes on or underwear on. It includes standing and bending over, for instance, to pick something up off the floor or to feed your pet, anything like that. We're going to cover ways that you can do those sorts of things without bending 90 degrees. Occupational therapy will teach you to use different adaptive equipment, and we'll talk to you about how to get in and out of chairs and things like that without bending more than 90 degrees. There's also precautions about crossing your legs or your ankles. You'll find when you wake up in the OR and in our med-surg room that we'll have a pillow between your legs to keep you from crossing your legs. That becomes kind of an issue with people who are used to sleeping on their sides. For a while, you won't be able to sleep on your side. You'll need to sleep on your back and keep those knees apart. The last one is not to turn your toes or twist your leg inwards. That typically happens when a person plants that foot and turns towards their surgery side. So even now you could practice picking that foot up when you turn towards your bad hip in order to prevent you from twisting that foot in. The anterior hip precautions are a little bit easier. The main things to avoid there are extending your hip or rotating your foot out excessively. The times when people need to avoid that tend to be when you sleep on your stomach or if you do certain stretches where you're forcing that leg backwards or toeing out. So shouldn't be too hard to avoid those afterwards. Again, for how long ultimately your surgeon will decide based on the quality of your tissue, your other medical problems, but to minimize the risk of it dislocating, typically it will be 6 to 8 weeks at a minimum. The exercises that we're going to go through, again, are very important. First of all, because you've probably been hurting in that leg, you've avoided doing things that would stress the muscles, so some weakness has probably settled into that leg. You also have some inhibition of the muscle due to pain, and right now, this is a good time to learn the exercises. You're not under a narcotic pain medication or anesthesia. You're not being overloaded with a lot of information from nursing and therapies and the doctor. So this is a good time to learn how to contract the muscle, how to do the exercises correctly, and also build up that strength now so your recovery is faster after surgery. So the exercises, the first exercise we're doing here, as you can see on the picture, you're going to press your knee down into the bed and tighten the muscle on the top of your thigh. Now you can do this laying flat on your back. You don't have to do this sitting up the way the picture is. And if you do feel some pain in your knee doing this, you could put a small rolled up towel or a small pillow under your knee, and that should make that more comfortable. You would hold this for 5 seconds and do that 10 times twice a day. The next exercise, this heel slide, you could do this laying on your bed and maybe have like a plastic bag or maybe like a cookie sheet or a smooth board underneath your foot, and just slide your heel up towards you, towards your bottom, as far as you can comfortably. We're not trying to gain range of motion, we're just trying to work the muscles that you'll need after surgery. So just going up and down, straightening and bending that knee 10 times, and again, do that twice a day. The straight leg raise, you lie on your back with your good leg bent up, and you'll lift the straight leg up approximately 1.5 feet off the ground, and then lower it back down. This exercise is important because that leg is going to feel very heavy and it's going to be weak after surgery. You're going to have a hard time lifting your leg into bed or to get it in and out of the car. So this exercise strengthens that muscle. I've had patients before that have strained this muscle after surgery because it got so weak preoperatively, and when they start trying to lift their leg in, they strain that muscle. So this helps prevent those issues. You would do 10 of those, rest, do 10 more a couple times a day. Then sliding your leg sideways. Again, on the bed, just don't lift it up off the bed, just slide it out sideways, whatever's comfortable. You're not trying to gain range of motion, you're just trying to work the muscle, so don't go out any further than you have pain. Do that 10 times, relax, and then do 10 more 2 times a day. This exercise, you would want to probably roll up a blanket or crunch up a towel, something that's so that the final diameter of that is between 6 and 8 inches. Place that under your knee. Again, you could be laying on your back instead of sitting up like this picture shows, but you would hold that leg up off the ground for 5 seconds, lower it down, and do 10 of those, relax, and do 10 more twice a day. That's to build up the muscle on the front of your thigh. That's an extremely important muscle group after a knee replacement. It helps keep your knee from buckling. It helps you get up and down out of chairs and to go upstairs. So this is a great time to get that stronger. This exercise is specifically for a hip replacement. You're just going to squeeze your buttocks together for 5 seconds and then relax and repeat that 10 times twice a day. This is a muscle group that they cut through to do your surgery. Again, we want to get that muscle group working quickly after surgery. And then finally, sitting in a chair and straightening your knee, holding it for 5 seconds, and then lowering it again, doing that 10 times, relax, and do another set of 10 twice a day to build up that quadricep muscle. You do want to be in a chair that's somewhat higher so that your leg can move through the range of motion, that you don't bottom out too quickly.
Hi, my name's Ashley. I'm from occupational therapy. So I'm going to kind of continue where Dave's left off. The first thing I want to talk to you about is he mentioned all the leg exercises we want you to complete, and I'm going to throw in one for arms. We call it a chair push-up, so I want you to find a chair with some armrests on it and sit in the chair, and then push through your arms and try to lift your bum off the chair if you can, lower down, do 10 reps, rest, 10 more twice a day. We would like you to add those in with your leg exercises because what you'll find is after surgery, you are going to be using your arms a lot more to get up and down and move around, as well as through your walker. So we really would like those to be as strong as they can before surgery. I know Carrie mentioned thinking about your home or your coach's home, and I really want to drive home the idea of getting it ready. We want to keep you safe, and we don't want you to fall. So things you can consider are throw rugs. If there's throw rugs in your house, consider rolling those up and tucking those away. They get caught up in our walkers and people fall. Anything large you would like to do in your home to get ready, such as getting your house clean, doing laundry, washing your sheets. What season is it? Do you have to manage snow? Do you have to mow the lawn? Do you have to do leaves? All of those are going to be very challenging after surgery, so if you can get some help or if you have projects to do, try to get them done before surgery. Also, go grocery shopping and make extra meals. Think about if there's anything you would trip on in your home. Move cords, tape them down. Lots of extra ice in the freezer. I know that we really try to prepare you for that. But then, where are items in your home that you use often? Think about in your fridge, in your kitchen, in your bathroom, even in your closet. Move items to a level that are easy to reach. So eye level to kind of hip level, so you don't have to bend over and reach for things or reach really high to reach them. Move your cell phone chargers to where you're going to be resting. Think about where you are going to be resting. Do you have a favorite chair? How low is that? Is it easy to get in and out of? Night lights. You're going to be moving around now in the middle of the night if you have to go to the bathroom with a walker. So consider having a little bit more lighting so that you won't try to fall. Do you have your bedroom set up on the main floor? We talked about this before, but even a temporary one is a great idea to avoid a lot of stairs. Unfortunately, in the bathrooms is where a lot of people trip and fall. So think about your bathtub setup, but also think about there's non-skid mats or stickers that you can put on temporarily, grab bars, shower chairs, shower benches to reduce your risk of slipping. And then, do you have pets? If you do, consider making arrangements for them for a couple of days, or make sure that their supplies are easy for you to reach, and how are you going to get them in and out from outside? So I did mention this a little bit, but think about your chairs that you normally sit in. Do they have armrests? Some people even put risers underneath their favorite chair so they can get up and down. Cushions or pillows are helpful that you can put on the seat to raise it up a little bit so that transfer is easier. The bathroom. Do you have grab bars? Will you need them? Now is a good time to get them installed if you think you would. Is the toilet low? There are risers. Can you grab onto anything next to your toilet? Is there a vanity, and is that stable to help you? All of these are things that to prepare for now so that your house is the most safe it can be. I'm going to talk a little bit about equipment. If you have questions, though, about managing at home after surgery, please contact social services to discuss options such as equipment or even home health, or there are some options depending on your insurance for post-acute care. So depending on your surgery and your flexibility after surgery, depends on then what equipment you'll need. So the one thing you will for sure need is a walker. Our preferred is called a front-wheeled walker. So that's the aluminum frame standard walker. Sometimes they have little wheels on the front, sometimes they don't. Those are the most stable, and they will make it a less risk fall for you. Often we have patients ask about four-wheeled walkers or even crutches and canes. Those options are out there, but I will tell you that us therapists prefer the standard walker. Other equipment that you may need if you have a tub shower combo is a bath bench. Depending on if you're a hip or a knee, the smaller equipment is based on how you're doing after. The posterior hips, however, if that is what you're having for a replacement, you are not able to bend down to reach your feet. So you will need a reacher, a sock aid, and a shoehorn. I will show you pictures of those coming up in the slides. Unless you have a coach that is willing to help you with those for 6 to 8 weeks, those are things you will want to consider purchasing. As for knees, like I said, you may need some of those smaller bits of equipment that I mentioned, but you may not. The nice thing is that when you're here in the hospital with us in therapy, We will go over how you're doing and how you're moving, and you will be getting dressed with me. If you need that smaller equipment at that time, I will train you on how to use it, and I'll show you places that you can obtain it. Let's see. Okay, this is a picture of a bath bench. The wonderful thing about a bath bench is 2 of the legs sit outside of the tub and 2 sit inside. So you sit down on the outside of the tub, then you lift your legs over and you slide over and stand up inside the tub, or stay sitting when you're showering. This is the safest way to do that big transfer into a tub. If you can't obtain one of these, that's okay. I will practice a tub transfer with you here and we'll make sure that you feel safe. There are tub chairs as well that sit all the way in, and then again, if you have access to that, I will show you how to use it. There's something called a handy bar. It truly is a small little handle that clicks into the frame of the car. Many patients enjoy this. If it's hard to get in and out of the car, it gives you another handle to be able to safely enter. The top of this picture is a reacher, and the bottom is a sock aid. A reacher is used widely for people with, if they drop something on the floor or reaching up high, but also if with a hip replacement, you cannot bend over. This is how you get on your pants and underwear after surgery, and I will teach you the techniques. The sock aid is how you slide on socks. Both of these are inexpensive, easily found. You can look at places like Equip, the same place with that ice machine. Some of these are even located in our pharmacy downstairs and online. This is a leg lifter. As Dave mentioned, your leg is going to feel very heavy after surgery, and often it's a lot of strain to try to get it into bed. This is truly one of a patient's favorites of equipment. You can loop your toe and you can lift your leg with your arm so that you can get it in and out of bed, in and out of chair, even the edge of the tub. So those are very helpful and again, inexpensive and found at many locations. So if you are borrowing a walker, then you want to make sure the walker can fit you. There are different sizes of walkers. Most walkers can be adjusted with pins on the bottom of the walker, but they only adjust so far. So if you're borrowing, step inside the walker and rest your arms at your sides. And when you're standing inside, it should hit, we call it at the wrist crease. So that crease right in the inside of your wrist, that's where the top of the walker should land. So that when you're walking, you have a little bit of bend in your elbow, which you can see in that picture, so that you can bear some weight. We don't want you stooped over because then your back gets sore, and we don't want your arms way up high because then your shoulders get sore. So that's how you would fit it. If you are getting a new walker and you get an order and a walker is provided, they should fit it for you. If you have any questions at all about fitting, please feel free to bring your walker in with you for surgery. And then when you're working with us in the hospital, we'll make sure that it's fit well.
Hi, we're the social workers here at Perham Health. I'm Jenny Dahl.
And I'm Taylor Helmke, and we're here to help you before and after your upcoming surgery.
Some of the things that we can assist with prior to your surgery include any questions regarding insurance or finances, whether you have a straight Medicare plan with a supplemental insurance, or you have a Medicare replacement plan or medical assistance. We are happy to answer any questions that you might have regarding your insurance or finances. We also can assist you with questions regarding transportation, whether it's to any appointments leading up to your surgery or following your surgery. We also oftentimes help patients with healthcare directives and post documents. We also help with making referrals for any durable medical equipment that you might need. So feel free to reach out to us with any of those questions prior to your surgery.
There are many things that social services assists with after your surgery is done. We are able to help you find support in different services following your surgery, such as home health care and the different agencies that are available, PCA services, getting support, a lifeline, home delivered meals, finding a short-term rehab stay if needed, and transportation after your surgery is done.
If you have questions or if you'd like to set up an appointment with either one of us, feel free to reach out to us at 218-347-1665.
We know this was a lot of information. We do repeat ourselves multiple times. When you're here, we will repeat ourselves again. If you have any questions through this whole presentation, please feel free to write them down. Ask at any of your upcoming appointments, as well as there's a card inside your folder. Feel free to call and ask questions, and we'll answer as many as we can before, as well as when you're here. Thank you.